name is Christy Bateman, and this is my HEENT assessment, and Erica is going to be my patient today. So I'm going to gather my appropriate equipment. I need my otoscope and my pin light. I'm going to provide privacy and hand hygiene. So I'm going to observe her appearance. She's clean. She looks like she showers. There's no physical deformities at all. So she's clean. She looks like she takes care of herself. Her clothing is intact. It doesn't look worn or worn down. Her clothing is appropriate for the season, and she looks clean and neat. Her skin color looks pink, warm, and dry. And there's no lesions that I can see or anything. And she's sitting upright at a 90-degree angle. And her affect and mood looks appropriate for the situation. And are you having any appetite issues?
No.
At all? No? Okay. So her speech is clear, and she can hear normal voice tones. I know that because she answered my question. I'm going to move on to the head part of the assessment. So she's making eye contact with me. Her level of consciousness, she's awake and alert. Can you tell me what your name is?
My name is Erica McKnight.
Can you tell me where we're at?
We're at my house.
Okay, can you tell me why we're here today?
So you can do your video for school.
Awesome. And can you tell me what month it is?
It is February.
Awesome. Okay, so she's oriented ×4. So now I'm going to inspect her head. Her face looks symmetrical. Her scalp, I don't see any lesions or anything, but I'm going to feel her head. There's no like lesions or bumps or anything. Her occipital lobe is well intact. Her hair is clean, and there's no dandruff or anything. And I didn't feel any bumps or anything, so she looks like she really does good hair care. Her face is symmetrical. I'm going to feel her temporal pulse and her temporal artery, and it is strong and equal bilaterally. And can you open and close your mouth for me? One more time. Okay, so her temporal mandibular joint is intact. There's no grinding or locking of her jaw. I'm going to feel her sinuses now. Do you feel any pain or pressure at all?
No.
Okay, so her sinuses, she doesn't feel any pain. So those are all good. Okay, now I'm going to move on to the eye part of the assessment. So I'm going to do the confrontation test to test her peripheral vision. So tell me when you can see my fingers wiggling. Okay, good. Okay, good. Okay, good. Okay, so her peripheral vision is intact. I'm going to test her corneal light reflex just by shining my light in both of her eyes, and that is intact. I'm going to do the 6 cardinal signs, cardinal directions. Can you look at my pen light? Just follow it. Okay, so her extraocular movements are intact. I'm going to test her eyes and see if they are perla. So I'm going to shine this in your left eye twice, and your right eye twice. Okay, and with the right pen light, look back at the wall, look back at my pen light, and follow it down. Okay, so her pupils are equal and round, and they react to light when I shine my pen light, and they are accommodating. So her eyes are perla. Her pupil size is about 2 millimeters, and they are equal to each other. So another way to test visual acuity is if I had a Snellen chart here, and that would be, I would use the alphabet Snellen chart since she is in young adult, and I would have her stand 20 feet away and read the smallest line that she can, and this would tell me her visual acuity. So now I'm going to inspect the ears with my otoscope. So first I'm just going to inspect and see that they are symmetrical to each other. I see she has holes where her piercings are, and it doesn't look like there's any drainage or scabs or lesions or anything, and the skin is intact. Um, so now with my otoscope, I'm going to pull up and back on the canal. And her tympanic membrane and the canal is pearly white. There's no redness, and there's no drainage that I can see. Yeah, there's no drainage or anything there. So, okay, and yeah, her tympanic membrane is, everything's intact. There's no lesions or sores on the inside. Now I'm going to do the whisper test. So I'm going to stand over here and I'm going to plug one of your ears and I'm going to say a two-syllable word and I need you to repeat it back. Okay? Water. Okay, good. I'm going to go on this side.
Makeup.
Good. Awesome. Okay, so she passed the whisper test and now I'm going to move on to the nose part. So I'm going to inspect for symmetry. It's symmetrical. There is no um, lumps or anything that I can tell right now. Can you cover one of your nostrils? And can you breathe okay out of that one? Okay, cover the other one. Can you breathe okay? All right, so her both nostrils are patent. I'm going to just use my pen light and inspect the mucosa of the nose and make sure that her septum's not deviated or anything. So can you tilt your head back for me? Okay, I don't see any drainage. Her septum is not deviated and it is nice and pink on the inside. There's no drainage. Okay, and now I'm going to move on to the mouth and throat part of the assessment. So can you open your mouth for me? Can you say ah? Okay, so her uvula is midline. Everything on the inside of her mouth, her upper palate, her tongue, her gums, they're all pink and nice and moist. Her teeth are intact. They're white. She looks like she takes really good care of them. Um, her uvula is midline and it's pink and it moves when she says ah, so that's a good sign. And her tonsils aren't swollen or anything. And her cranial nerve 9 and 10 are intact when she said ah. Um, can you stick out your tongue for me? Can you move it side to side? All right, so her cranial nerve 12 is intact also. Now I'm going to move on to the neck part of the assessment. So I'm going to just look at her and inspect for symmetry. Her neck is symmetrical. I don't see any nodules or bumps or masses or anything like that from her neck. Um, and she does not have any jugular vein distension that I can note. So that's good. So now I'm going to move on to palpating the lymph nodes of the neck and head. So far they're not swollen. They're not swollen and she didn't feel, did you feel any pain when I did that? She didn't feel any pain when I palpated the lymph nodes. I'm going to feel your carotid holes. And they are strong and equal bilaterally. I'm going to feel your trachea. I'm going to slightly move it side to side. So her trachea is midline. You feel your thyroid. Her thyroid gland is intact. It's not swollen. There's no nodules or anything abnormal. Can you move your neck from side to side, back, down, touch your chin to your chest? So her neck range of motion is intact. Can you push my hands up with your shoulders, scrub your shoulders? There we go. Awesome. So her muscle strength in her neck is intact and really strong and equal bilaterally. She uses both sides equally. And And I believe this completes my HEENT assessment. Thank you.